This week on the 77% Street Debate.
I became suicidal at the age of 10, and at the age of 16, I started attempting suicide.
We want mental health to be prioritized.
And there's also no protection. The police also, make fun of people with mental health issues. These laws have been passed, but they're not being implemented.
I am, for lack of a better word, I'm disappointed to hear that you're devaluing the Mental Health Act to that level.
Anxiety, depression, bipolar disorder, mental health issues like these are seen as taboo topics in many African societies. With limited access to medical healthcare services, young Africans struggling with their mental health are left to their own devices. The DW 77% is in Zambia, precisely Lusaka, to look at this silent epidemic, so-called silent epidemic, and of course talk to the people at the heart of its advocacy. And I'm going to start off with here Mr. Benjamin, who has 10 years experience, of course, talking about mental health. First of all, just give us an overview of the mental health situation here in Zambia.
We have most of our services highly centralized in Lusaka, and these services, we have government institutions and of private practice coming up. And we have a number of institutions that are also providing like telephone counseling or teletherapy services, just to make sure that access to mental health services is made available, accessible and affordable, even to those who are not within Lusaka.
All right, let me just come to Namatama here. Benjamin has been in the advocacy for over 10 years. You started just 2 years ago. Tell us, what has been your focus? Is it that for the past decade, a lot of work has not been done in this that made you want to start your own advocacy as well?
So my focus has been on raising mental health awareness and ending the stigma that surrounds mental health, because in the past, people have been glued to or have stuck to these misconceptions about mental health, such as the belief that mental illness is a curse or it's demon possession. So my focus has been to debunk those myths and make people realize that mental illness is something that can attack anyone.
And we have Duncan here, who yourself has experienced this live. Talk to us about your experience with mental health. How was that phase of your life like?
I struggled with depression and anxiety for over 12 years. In that moment, I became suicidal at the age of 10. And at the age of 16, I started attempting suicide. I had a migraine headache somewhere at the age of 6, which I developed sores on my lips. Sometimes whenever I go to school at home, my friends would laugh at me that because pulse and blood would even come out of my lips. So I received rejection from there, and coming from a broken home as well. So I felt I had low self-esteem. And my anxiety came in as a way of, I was so much scared of the future, because there was a point in my life the doctor told me that I might even go blind because of the migraine headache, which had started affecting my eyes. So I sat down and I thought, what's there in the future? And with just the way things were, because we struggled so much in the family when mom and dad separated. We went through so much financially, so there was no any form of hope for me.
What about the family, your immediate surrounding? Did they understand what you were going through briefly?
I know they did not understand.
Okay, let me just come to Mom here briefly. She is Duncan's mom. Mom, if you could just tell us how you feel after realizing that your child was actually struggling with mental health and you could not really pinpoint that was actually what he was going through.
Pamene namvera chabe after abwera kuchoka kuchipata mamene anapita kuniuza kuti mami nezofuna kuzipaya ninamuuza nata sunga zipaye chifuka daily pamene nezokutumira ndizopempera akanitumira mu situation amene nezopitamo nezopempera daily uzapeza kuti daily pamene afuna kuzipaya na inde pamene ntuma phone nizamulimbikisa.
Did you receive any sort of help during this phase?
I never did, and the sad part is I never knew that I was struggling with mental health. I had no idea of what mental health is.
Let me just come back to you quickly, Benjamin. When we are looking at some of the causes, some of the societal causes that are actually resulting to some of these mental health issues in Zambia, what are some of those that you've encountered?
So the most common causes of mental health issues in Zambia possible to talk about increased substance abuse, alcohol and drug abuse in young people. But we also want to emphasize on the aspect of what we call the biopsychosocial. So some individuals are usually biologically predisposed, where they are born in families where there is a significant history of family members being treated or untreated with mental illness. These stressors would perpetuate the yes, and eventually lead to an episode that now someone would need psychological and either pharmacological support or intervention.
Let me just come quickly to Pilato here, who of course talks about a lot of social issues. You are a poet, a musician, voice of the voiceless. How do you see the issue of mental health in Zambia?
I think the conversation around mental health is probably one of the exclusive conversations. You can't find such conversations in poor communities.
Why do you think it's like that here?
I'll tell you, the poor people have no excuse for whatever happens in the mind. If you're dull at school, they'll say you're just dull. If you're traumatized, nobody will know that you're traumatized. Most of these kids lose their parents when they're young. Most of these kids experience so much without nobody paying attention to them. So this conversation is exclusive to a certain class of people that have an opportunity to even understand or even access this conversation around mental health.
Let me come to you, Duncan, quickly to just take us through that state of mind, really. What was it when you were going through? What was it that you felt that you needed? What were you communicating through your actions, your emotions, that people were feeling very difficult to understand and grab? How did that make you feel?
I showed all the signs of suicide to my family, the people that I was living with, but nobody could be able to recognize my mental state. So I had to withdraw from people. I lived a lonely life and I was very shy. I had low self-esteem as well. I also could talk much about death and write so much about dying would be the only solution, the only way out. So I showed all those signs. Sometimes I'll talk to maybe spiritual people, but they'll tell me, let's pray about it. So I felt less understood, and I felt the only way out is just to end my life.
I mean, you talked about seeking for spiritual help as well, Duncan. Let me just come to Dr. Francesca here. Tell us, how is the situation of medical access when it comes to treatment services?
Mental health is a health presentation like any other health presentation. Thus, if an individual feels like they've got any mental health issue or condition or problem, they should go to their nearest mental health center. Just like we go to the nearest health center for a headache, for hypertension, diabetes, HIV.
This is not the case here. We are in the only, by the way, the only mental health hospital, which is Chainama. This is the only one we have in Zambia. Is that correct?
Allow me to correct that statement.
Please go ahead.
So it's the tertiary psychiatric hospital. It's the final referral hospital when it comes to mental health. So we can consider it like the center of excellence when it comes to psychiatric practice.
But is mental health really embedded in your primary healthcare system? This is what the question is.
I think this is something that we're constantly investing in. And I believe this is not something that is unique to Zambia. It's actually a global issue. I think for a long time, mental health has been sidelined in the practice of medicine.
But are you now excusing the situation
excusing.
here because we're trying to move
to
forward?
the answer.
Okay.
A major area that we've started is with primary health care is awareness and sensitization. As you have heard from Namatama, from Duncan, even from Benjamin, even Pilato mentioned, we need to reach out to the community. So firstly, on our strategy has been improving awareness and sensitization around mental health.
I will come back to that. Okay. I will come back to what exactly you are doing moving forward. But for now, we've established that there is a problem. Let's talk about that briefly. And please introduce yourself.
Yeah, I'm Abraham Machina. I'm a psychiatrist. Some of the things that we want to tackle is, and we want to improve on. It's not just about talking and coming on TV and making a show, but what we want to send to the world there and what we want to achieve as Africa, as Zambia, is that we want mental health to be prioritized.
So right now it is not a priority. Is that what you're saying?
Yeah, and this I'll say through my bone, yes, because I'm an advocate for a mental health patient. They would rather sponsor a patient who's suffering from cancer and not me. Why? Because it's not a priority.
But let me just come back to Dr. Francesca here. I'll come back to you. That he said it is not a priority for this country, mental health.
I will beg to differ. One, as I am speaking right now here, if you compare it maybe to other conditions like HIV, TB, which are well funded, and we have many partners funding that way, it will look like the ministry is only prioritizing those areas, when that is not the case. We have many international partners on board that are funding those activities. So it will make a field of medicine like mental health, which doesn't have many partners, look like it's been neglected.
Okay.
And further, on top of that, I know you said we're going to talk about some of the things that we are doing.
Yes, I'll come back to that later because I am still trying to understand if it's really been prioritized. And I'm going to come to you, Duncan, here. Would you say it has really been prioritized? You've mentioned not having enough partners. That could probably also sound like there's not much interest vested in that, if you would want to just come in there.
For me, my comment on that is that I feel there's more that can be done because, for example, I struggled with depression and anxiety for 12 years. I was a young person in school. I never saw anything about mental health on TV. If doctor, you're saying that it's been given that attention, but then why is it like that? Because I feel if I had people that came to my school to talk about mental health, I would have definitely known what I'm struggling with, and I would have reached out and sought for help.
Okay. As an activist, you also have a platform, right? You have a blog. Is that called a podcast? How do you center the communication around mental health? Because, of course, the media is very important in that crusade.
Okay, so on my radio podcast, I usually include professionals and also people with lived experience. Also, I make sure that every time I'm on radio, I go on Facebook Live so that everyone has an opportunity to listen and also chip in. We get calls. And also, apart from that, we go to schools and communities to also talk about mental health. Please allow me to contribute to the question that you had asked Dr. Walia on whether mental health is a priority. I don't agree. Honestly speaking, we only see the government doing things during these special days like Suicide Prevention Day and Mental Health Day. And then even when we go to these hospitals that they claim help people with their mental health, there's a lot of stigma. You'll find that I go in there with a mental health problem and the doctor is actually going to taunt me and laugh at me. And there's also no protection. The police also, make fun of people with mental health issues. And where do you report that to? Nobody takes that seriously, so definitely it's not a priority.
Pilato, would you agree on that?
I do agree with Namatama. And also, I also think that the claim that we need to raise awareness is a lie, because there's no need for you to raise awareness when you don't have the facilities, the hospitals, the trained people to work on the problem. What I think is, because if you raise awareness, you're raising the demand. So now if you raise the demand of people to go to the hospitals, who is going to treat them? If you do not have facilities that will attend to these people, then where are they going to be?
Let me come back to you, Doctor, because I think the unanimous agreement or statement here is the fact that the people also who need to attend to people struggling with mental health are not really there. Some have the papers or the degree, but they're not employed in the system. Why is that?
So indeed, we have a lot of work to do when it comes to mental health. That I would not deny. We have a lot of work to do. And it's an upcoming field in medicine and in health, globally, I should emphasize that. And I think as Zambia in the region, I think we're doing pretty well. Though, allow me to...
You're doing pretty well. What's the indicator for that?
We have several projects. Mental health is amongst those areas of fields in health that we are factoring in. They've raised a very good concern about the health facilities. Allow me to educate my panelists as well as the public. Let me take advantage of this platform. When we go for health practice or medical practice, you know that for every proper medical health practice, you have to rotate through psychiatry, through mental health. It's part of our education system. And in Zambia, we've prioritized it to ensure that everyone who graduates in the health sector should have rotated through psychiatry. Thus, Pilato Namatama, when any individual comes to a health facility, they should get the initial mental health. All of us medical health personnel have been trained in psychiatry and mental health.
I wanted to challenge what the doctor said. Okay. So being able to being trained to diagnose an illness does not mean treating that illness.
Okay.
Yes, so they are able to see that, they're able to know that, but do they have the power, the necessary tools, the necessary equipment to treat it? Because if they say they are trained to diagnose it, then what's the point? How many people do we have in the rural areas that have been treated for mental health problems?
Mm-hmm. And I think that is what I wanted to raise again here. If the people are there, they can diagnose, but if the facility is not giving the right treatment, then what's the point?
This comes back to us. The onus is on every health personnel to take up their mentor and prioritize mental health. And that is what we keep encouraging.
Okay.
For mental health, what is key is a good history taking. Remember, it's psychological, it's information, it's social. This is what we aim to train.
Are you really dealing with the psychosocial aspect of it as well? Because then why are we having suicide?
Suicide is everywhere. There are many reasons why one will reach to a level of suicide. And there are many factors to a presentation of suicide. First one, the individual factors are there. First, is the individual able to open up to anyone? How is it portraying? Remember, even the most famous people in the world, with so many people around them, have committed suicide. They've got access to all the best mental health facilities, best mental health doctors, psychotherapists, psychiatrists on their team.
Okay.
And they still commit suicide with a smile on their face.
I'm going to come back because Duncan did mention that in the beginning, he did not have a place to go to. And even where he went to hospitals or places, they could not really tell what his problem was.
Thank you. This is what we're trying to normalize, Duncan. Are we saying that there hasn't been some shortfalls? No. But are we working on them? Yes.
I'll come back to you. But let me just come to Namatama quickly before I come back. You are studying psychiatry. Tell me, how is the enrollment of this field in your school? And how many people do you have in your class, just to know the numbers here?
Mm-hmm. So the enrollment is not so difficult. And in my class, currently, we are about 36. In as much as people may want to study psychiatry, I guess the interest is growing slowly. But then, even when we were getting into this field, our former students would tell us that we are just wasting our time. You better find something else to do because the government doesn't employ as many. So, even our lecturers sometimes advise us that we should create our own employment, create your own mental health facilities because the government does not employ people.
That will be private and very much expensive as well.
Exactly.
If that is going to be.
Exactly.
Let me just come to you quickly here. Yes, tell me. What do you want to comment on that?
So the problem that we're having is the information gap. Most people don't know about mental health, right? There's so many stereotypes towards mental health, so many beliefs and misconceptions that need to be broken down first. So we need everyone here, the advocates and stuff like that, what they really need to do is get to the grassroots. Because at the moment, it's regarded as something that's spiritual. Someone might be going through, Duncan mentioned, right? He was going through a mental health challenge. When he went to people to ask about what was going on, people didn't know what to tell him. They didn't know what was going on, right? That just shows us the real problem that we need to address, which is the information gap.
There's an information and awareness gap. And again, someone is talking about traditional, resorting to traditional means. I mean, this is a medical issue, but traditional healers make a major part of its workforce. Are you, in fact, regulating their operation? How do you oversee this?
That's why earlier on I brought up the issue of sensitization and awareness. It's important. A lot of stigma that we're seeing is because of a lack of knowledge.
But then who bears the highest responsibility? Yes, the state is the primary duty bearer. This is where you should have started.
We have to understand Zambia's cultural context. There are two aspects. There's the spiritual aspect of Zambia. Zambia is a Christian nation. Secondly, we have the traditional aspect as well. So even when we talk about mental health has a lot to do with beliefs, psychological, social perception to life. So meaning, even as we approach various individuals, we have to factor in that.
So this is a pathway you are actually looking forward to undertake. We
are considering everything and everyone, and we're getting everyone on board. Traditional people, we're getting them on board. Spiritual people, we're getting them on board. Academics, we're getting them on board. Mental health personnel, we're getting them on board. We're calling everyone together. It's everyone's problem. The solution comes in the homes. It starts from the homes.
Interesting. Let me just come to you, Benjamin, quickly. Do you agree to that point? Of course, merging the traditional healers with the biomeds, if you like. Do you think that this could be a possible pathway to this issue?
It shouldn't be a possible pathway. It should be part of the pathway. Before everything else, we belong to a community or a system. And obviously we start with a family unit, right? If they have traditional issues of values which they practice and they value, if they promote healing, that is what we're calling holistic approach to care and treatment.
Yeah. Doctor, you wanted to clarify a point.
Yes. So as much as there's the spiritual, a cultural, traditional context, remember, we'll still have to be firm when it comes to the medical treatment. Let me give an example of something common like HIV. A lot of people are usually in denial about HIV and they'll seek alternative treatment, traditional treatment, prayers, but after some time we still counsel them to come to a point to realize that, please, you also need to adhere to our treatment and our medical guidance.
And that's why I ask, where do you draw the line? And how are you trying to make people understand that at some point this is a medical issue, even though maybe the spiritual aspect might be there, as most of you have said, but where do you draw this line going forward?
Yes, so I think even in practice, we try to make an effort to do that, but at the same time being very respectful of the client's opinion, view, and perception, but still being very objective in our communication and also still highlighting the medical aspect.
Let me just come back to you, Duncan, before I come there. You wanted to say something.
I would love to ask the government to also especially include advocates and activists as well, to also give them a part there where they can also begin to reach out. Yeah.
Very well. And if Mama can just also tell us, because someone mentioned a very important point, that it needs a holistic approach, and that means everybody, the system, has to be functioning. So tell me, going forward, how has the struggle of Duncan, your son here, changed your perception?
Ninga advise my parents ukuthi vana vazirangana vana ngati muntu ali mai ali onse aziva vana mwamene valiri ngati waona mwana saoneka bwino saenda bwino aoneka kugonerera mukonke umufunse nchani chivuta ine namuona pamene anafika gonerera achita bwanji namukonka ufuna chani kuchitire chani. So pali icho nifuna uzikisa makolo kuti makolo batandize vana nawo makolo bafunika kutandiza vana kuli si viveka kuli kudwala bena kubana ma HIV makolo ngati suika mwana pafupi uzapeza kuti uja mwana achita society.
Let me just come to you, Namatama, because someone mentioned that the 2019 mental health law, the act has been passed, right? Which means it's now into law. So, I mean, it also has to cater for protection, non-discrimination of people struggling with mental health. But is this a progressive attempt on the side of the government, looking at where you've come from, the other laws that you had?
From my perspective, no, because some of the things that are in the Mental Health Act are things such as a mental patient should not be discriminated and they shouldn't be called derogatory terms. When you go to the police station and report something, the moment you say you are a mental patient, you get ridiculed. The police don't take those things seriously. It's like these laws have been passed, but they're not being implemented.
I am, for lack of a better word, I'm disappointed to hear that you're devaluing the Mental Health Act to that level. We've been applauded for that Mental Health Act. And that was a huge step for mental health because it protects, it promotes the same people that you're advocating for.
But what she's saying is it really gaining fruition in terms of the implementation aspect of it? Because if that is not there, then the law is still meaningless.
It is, dear. We have a lot of political buy-in. Our permanent secretary in the health, for all the major programs that have been facilitating, this mentality of saying government will sort something else alone, it's a wrong attitude and mentality.
Because government is the primary duty bearer.
We hear you, but we are helping with facilitating with policy. We need to understand that. We can't compare mental health to other areas in health right now. Okay. It will be a misnomer.
We're still on way forward, just way forward. Yes, you were raising your hand. Yeah.
How are you offering solutions? You don't have a stigma index.
You're saying the government does not have the system in place, or?
And they're not very unreliable, and I think you would honestly attest to that. So my question is that how are we offering solutions when you don't actually the population you're working with? You don't know what population is actually affected by stigma with regards to mental health personnel. You don't know what size of the population cannot access or cannot afford mental health services.
Are you saying this going forward should be a way forward to break this down, to make it easier?
Pretty much what I'm saying is that before we can actually go get forward, we should get the data first.
Someone here and then yes, to doctor.
Yes, I think in closing, I would really like us to have an understanding of I understand as an advocate, it's not my job to do the government's job. I'm here to hold the government accountable for where there are gaps and where things are not happening. And I feel like this is getting muddled in this conversation. So I think going forward, advocate, government.
Yeah.
It's not my job to do the government's job as an advocate.
I mean, I think that's clear as to why Dr. Francesca, we were having the conversation, of course, around the government is not doing it because you need to push and do a little bit more. And you've had unreliable data and some of the other issues that emanated. On the government side, what are you doing towards the issue of mental health now going forward?
There's a lot of training that's coming up for mental health personnel. We're doing a lot of supervisory and mentoring visits when it comes to mental health across the country. Then in terms of sensitization and awareness, top on our priority as well. We're looking into that. Then of course, one other important aspect that I'd like to highlight, we are calling for partners.
Thank you so much. I think we have heard it. What has just been established is that mental health is real. Mental health struggles are real and definitely exist in Zambia as well. I know that it can be too much to do so much, especially when it's supposed to be the work of the government. But as people, what we can do as well is to be more empathetic to one another, show love, show kindness, spread smiles where you can, because you never know what people are going through. This has been the 77% live from Zambia, and thank you so much for watching.